First of all, before I get started, I wanted to just take the temperature of the room and ask if you could share how many of you are here today are medical professionals. Could you raise your hand, please? Oh, good. How many of you have ever had a tick disease before? How many of you, according to Dr. Caldwell's definition, have tested positive for alpha-gal and also have symptoms? Wow. Okay, thank you so much for sharing that. So what I'm going to address is tick disease among people with darker complexions. Could you move through, please? And I also want to preface my talk by saying, in honor of all of you in this event, yesterday I was diagnosed with Lyme and started treatment yesterday. First time I've ever had Lyme in my 60 summers on this island, as far as I know. So I did that for you. So if I have a little bit of brain fog, that's why. So how I got started on this topic is years ago when I was training to be an EMT, I took a class and the textbook was about 500 pages full of pictures. And the real emphasis was on how, when you're an EMT, how much you use a patient's appearance to very quickly figure out what's wrong with them. You scan them before you even approach them to get a sense of what's wrong. And a lot of the things we look at in the medical field in general, and EMT specifically, is the skin. And so there are a couple of terms that they use. Erythema. Erythema is a fancy way of saying red or pink skin. And you use erythema as a sign of cellulitis, which is a deep infection below the skin, an abscess, necrotizing fasciitis, which can be very scary, angioedema, which has to do with infection of the blood vessels. Another thing we look for is pallor. Pallor means paleness. That can give us a sign of anemia or shock or circulatory disorders. Rashes, which we've been talking about today, hives, angioedema, drug reactions, things that measles, which will be a topic a lot. And then another thing is, and all these are affected by skin color. So, and a third thing that's affected by skin color is pulse oximetry, which is the little thing that they stick on your finger to measure how much oxygen you have. These ways that we look at medicine can be really problematic with people with darker complexions. And they don't need to be, but they are. And when I was taking that EMT class, there were hundreds and hundreds and hundreds of pictures in the textbooks of what these things look like on skin. The only picture of a person with a dark complexion was a picture of a sore of someone with syphilis. No other pictures. So what does Lyme look like in someone with darker complexion? That's the question. Next slide, please. It's harder to find the EM rash, the bullseye rash, on a person with darker complexion, and most of us in the medical field and in the community are not as educated about what that looks like. What happens as a result, there was a study done by Dr. Dan Lee of UCLA. 34% of Black patients are diagnosed late in the process. We miss the rash, versus 9% of white patients. Next slide, please. This is just a graph of the distribution. The African Americans are the orange color and white people are the blue color. As you can see, African Americans are 3 times as likely to get the neurological symptoms. Why is that? Because they're diagnosed late. Next slide, please. So there was also a study that was in the Journal of in JAMA in 2023. African Americans are have nearly 5 times the odds of disseminated disease compared to those who have the identified EM rash. As Avi Ryan told us, the disseminated disease is when it gets bad. They tend to have a longer duration time to diagnosis, 35 days on average. 35 days. Let that sink in. They're also more likely to be started on an inappropriate antibiotic, often some sort of skin manifestation people think that it's a skin infection and they're given a different antibiotic. They're not given doxycycline, so that's time wasted. Next slide, please. These are the charts from that report. The white people are the darkest color, and black people are the second darkest. And so you can see that African Americans have the lowest diagnosis of EM rash, but they are much more likely to end up with the disseminated rash. And their symptoms, which is the second graph, they're far more likely to have neurologic symptoms or arthritis because, in my opinion, of this late diagnosis. Next slide, please. So here are some examples of the EM rash on darker complected folks. And let's just have a moment to just look at that. Really not typical of the EM rash. Not what we think of it. And no red skin, no pink skin. But you can see variations in the skin. And so, you're looking for darker skin, lighter skin, not red or pink. Next slide, please. And here's another example. And next slide, please. And next slide. Now, I want to give you a little anecdote. We had this recent case of a tiny little baby with Powassan. I happened to be acquainted with somebody who a couple of years ago, who's African American, older gentleman. He was a couple of years ago having dramatic seizures and other symptoms, and they could not figure out what was wrong with him. And the seizures have decreased at this point, but he is suffering from a lot of the results of seizure after seizure after seizure after seizure. I don't know whether he had Powassan or not, but I wonder. And I wonder whether the color of his skin played a role in that. I don't know. And next slide, please. So how does this implicate us? Taking a closer look. The people that are at highest risks are hikers, landscapers, gardeners, people who work the trails. You all who live here year-round may have noticed that a lot of our gardeners and landscapers are from Jamaica or they're from Brazil. They have that darker complexion, and I really worry. I really worry about how many people are going undiagnosed and untreated, and how this is going to impact them in the long, long term. So I think it's really important that we educate the people who own these landscaping companies, so that they can educate their staff and make sure that they're on the lookout for these tick-borne diseases. Another problem is community awareness. So within these communities, I've heard African American people say, I didn't know that black people could get tick disease. There was a time where African Americans were less likely to want to go hiking. There were reasons for that. People didn't feel safe in the woods. They're crazy people in the woods. On this island, that's different. I know there are a lot of African American visitors who love hiking and really spend a lot of time out there in the trails. And I think a lot of folks don't know that this is a big, big danger. Another problem can be barriers to outreach. Language. How much of our tick information is translated for the Brazilian population. Community access, just how often do people who know about tick disease and Lyme disease have interaction with these different communities? And then the short duration of stay. I'm sure a lot of us have friends who came to visit and they went home and they ended up having tick disease, and their local provider didn't know anything about tick disease. They didn't test for it, they didn't know about it. And so if people are coming in shortly, they don't know that this is a risk for them. They go home and they might not get the treatment that they need or the testing that they need. And then lastly, what I hope is the smallest factor of this is medical bias and assumptions. But that's part of why I'm here and why I'm so glad there's so many of you here that are medical professionals. It's just, we've got to be on the lookout. We cannot ever assume that somebody with darker complexion does not have tick disease. That could have big consequences. Thank you.
Would you add Would you advocate for periodic screening for people whose professions continually expose them?
I think anyone who's having symptoms should get screening, but especially, I mean, I think that anyone who's, gardening and landscaping, if you're having flu-like symptoms, if you're having, any kind of tick symptoms, it makes sense to come in and get screened.
Will there ever be something for gardeners that could go in and just get tested without having to have a doctor's appointment first? Would there ever be a chance that there was, if they had symptoms, if you could give them a lab test?
I know that our practice owner is working with, our new practice owner, Jeff Levy, is working with employers about having, about paying for the care of their employees. So this would be something to explore. I think that's a good idea. Yes?
I would skip the employers. I would talk directly with those people who are working on the landscapes. And I live on Jackie, so we obviously have tick problems there. When I talk with the landscapers who are out in the field, chances are they have within, during the summertime, have had flu-like conditions. And I use that as kind of the metric that I'm trying to talk with people about whether they possibly have any particular diseases. And I think for all of us, we all have an opportunity to engage with those folks who are actively helping out on landscaping, doing a number of different things in regards to the landscape. We should talk with them.
Your point's really well taken. And I think a couple years ago when we were doing the Lyme disease study, the Pfizer vaccine study, we were trying to do outreach to that population. The best way to do that is actually through the churches, and maybe we need to go back and revisit that.
Talk into
Talk to the mic. Okay.
You said churches is a good question.
I just wanted to thank you for raising the issue of people with darker skin. Both of my kids are biracial. The younger one has chronic Lyme and was diagnosed 2 years after the first symptom. And I wanted to add to your list on implications, maybe summer programs for kids, Felix Neck, Farm Institute, places like that. I don't know if she could have been exposed in Pennsylvania. It turns out they're a hotspot too, but I think to educate those providers, because I really had no idea. She's 27. It was when she was 10 that she had her first symptom. So thank you so much.
Aubrey has a question.
I simply wanted to say, I have a lot of patients that come into the ER who work in landscaping or work outdoors otherwise. A lot of them are from Brazil, and the number of them that have absolutely no idea about tick-borne illness, many of them who have come recently, the ones who have been here for a while are aware more so. But I do think the concept of reaching out to employers as a group and preparing information in Portuguese or in English as well for these high-risk professions is really critical. And the disparity in the information distribution is huge. To live here as a landscaper and not be aware, to be looking for ticks and the symptoms of tick-borne illness is awful. I do think there's some information on the Martha's Vineyard Board of Health page that might be available in Portuguese, but letting people know where to find that information is the problem. It's been sitting there. So I think that kind of outreach is really critical here, and we're missing a huge portion of the population who's suffering these conditions and don't even know that they need to go in and get help.
Thank you.
Okay, one more question. John, in the back.
Thank you all very much indeed for this and for everything else you're doing. 20 years ago, Rick Carney produced the Island Blue Pages to deal with the grotesque problems of pollution facing island waters. This was printed in English. Several years later, Brett Stearns wonderfully got support from the tribe to have this produced in Brazilian Portuguese. This was for federal funding. I'm wondering about the level of support for this issue. It's wonderful that Martha's Vineyard Medical is doing this, and this is occurring under your auspices. But where is the rest of the island boards of health, the towns, the Martha's Vineyard Commission, the Martha's Vineyard Hospital, with respect to funding and support for all of this, for the production of clear information, for the dissemination of the information in English as well as Brazilian Portuguese, and whatever else is necessary, and for efforts in community outreach to direct people to the information.
Thank you so much. And I when I was asking who's here, I forgot to ask if you're willing to identify yourself, if anyone's here from the government, from anyone, any government officials here at all.
Any ICE agents?
Thank you.
Not funny. Okay, well, I want to thank our panel members, and we got to move on to.
No one answered his question. His question was, where are all these other
Oh, you're right.
organizations at with?
Well, I think we were wondering if anybody here has that information. Yeah, Aubrey.
Okay, I can answer. I can only speak to things I know about, but Leah Hamner at the Martha's Vineyard Board of Health has been amazing. She was going to be here today, but she's traveling. The work that's being done by the BOH and collecting data and making sure information is getting out there is amazing. Go visit their webpage. There's a bunch of stuff on there, but there's a whole tick-borne illness outreach page and data that's there. Patrick and I and Leah have been doing lots of talks at Still Point, which was just a really nice venue to have these sort of discussions. We've done one on alpha-gal. We have done one on Lyme disease. Patrick just did one on backyard tick control. Leah did one on tick bite prevention. And within all of those discussions are resources that we're giving out about where to go to get this information. I think the problem is really one of dissemination. We need to have a more centralized approach and not all these little siloed approaches to how we handle this. And I think we need to talk more to the media here, the hospital where I work but don't represent, as far as like the talks that I'm giving. There is some talk about putting information on the website because there isn't any, and that would also be available in both English and Portuguese. And then at the hospital, the other thing that I've done, we have these templated discharge instructions for various conditions. You have appendicitis, I can give you this information on appendicitis. There's a paucity of that when it comes to tick-borne illness. There is some, but it's not nuanced and it's not local to the vineyard. And certainly there was no information on alpha-gal. So I did create instructions going to alpha-gal info and talking with Scott Commons and Ed to create discharge instructions so that if you are seen at the hospital and tested for alpha-gal, the goal, and this is newish, my feeling is if you're being tested for alpha-gal, you should be given this information about what to expect if your test is positive. If you're not getting that, ask. Say, can you please make sure you give me some information about this? They can send it through the gateway because a lot of times those test results come back later, but you can say, hey, can you please send me this information? It is unfortunate that, we're still in a position where patients, and I'm a patient, not just a clinician, we have to advocate for ourselves, so ask those questions. And the more you ask, and if you're an employer or an owner of a landscape company, go to the public health office and say, hey, I need this information. The more pressure we put, the more information we'll get out there. But we're really trying to close those gaps as far as like people really not having access to it. I hope that helps answer your question a little bit, to the best of my ability.
The libraries host Zoom talks with people.
Yes, the library does. I think there was one in Container recently I didn't even know about. Still Point, we did one at Chilmark Community. I know Jeff and Martha's Vineyard Medical are going to be doing a lot more tick-related things, and that's really a primary goal of theirs, is to make this information very accessible and make sure that you guys are having the questions answered that you need answered. Sorry? Cell phones? Oh, you mean like in terms of social media and things like that? Oh, absolutely. I agree with that. Yeah.
Yes, I was just gonna say to that, I mean, it's not gonna help our tourism, but we may be at the point now. I mean, there's really only 3 points of access to this island: the air, the ferries, and then those people who have yachts.
The New York Times article,
And
the
it,
New York Times article already did us all in for like our property value.
yeah, so it may make sense to, I mean, the towns may decide, the Board of Health may decide that everybody who gets off a plane, everybody who gets off a ferry gets a flyer, so that they're informed, and the flyer is English on one side and Portuguese on the other. That would
I think Richard wants to add.
Hi, I'm Dick Johnson. I used to be the director of the PIC program before Patrick. We had a volunteer who spent a tremendous amount of time working with the steamship trying to allow us to get posters on it. And they said no. What they did allow us to do is to print up some brochures, and they used to sit right at the ticket desk as you came off of Woods Hole. They said if we had 25,000 of them, they'd let us put them on the boat. As with most of these problems, everything everybody's talking about, it's time and money. If somebody wants to, if you want to volunteer, you want to spend some time, one of the best things we do is have somebody go back to the steamship or a group of people and pressure them. Until we clone Patrick into 10 people, it's the people and it's the people in this room. You've got to take some responsibility. You've got to say, how can I help? And one of the things you could do is go to the steamship and say, or your local elected officials and say, you need to get involved in this, you need to get something on the steamship. If they get no pressure, they'll do it.
I wanted to mention one other thing that Martha's Vineyard Medical is doing, and I believe the hospital and Island Healthcare are too, but I'm not sure, which is we're involved in a new chronic Lyme disease study, which is being run out of Tufts and Mass General. And so anyone who has an EM rash, a bullseye rash, if you come to see any of the participants in the study, you have the option of having a skin biopsy and participating in the study. There's a little bit of a stipend that you're given for that. But I'm really excited that we're doing this. I know that the medical establishment doesn't have a lot to say about chronic Lyme, but I know on this island, people have a lot to say about chronic Lyme, and I'm really proud that we're participating in this study.
One more question, then we'll have to move on.
Audrey, could you please repeat the website you were referencing?
The question was, what website were you referencing?
For AlphaGo? Yeah, so alphagalinfo.org.
alphagalinformation.org.
If you just Google AlphaGal information, you'll see this website.
Not just AlphaGal, but boy, did you say something about a broader website?
Oh, MVDOH, thank you. Yeah, the Martha's Vineyard Board of Health. If you just Google Martha's Vineyard Board of Health ticks, it'll pop right up. It's on-
I'm going to repeat it just for the video. MVDOH. That's the Martha's Vineyard Board of Health.
Well, thank you, my colleagues, and we're going to clear the stage to present Patrick Roden Reynolds. And Paul Elias to talk a little bit about prevention